Hi everyone, welcome back to Conditions 1. This is part 2 of 3 of medical conditions affecting infants and young children. Next up is cardiac and circulatory conditions. Now there are a wide range of these conditions that affect infants and young children, and you're not going to be responsible for knowing all the ins and outs. The cardiac system and circulatory system is a very complicated part of human beings. And so the expectation is not that you know what all of these are, but that you're familiar, and that when you hear that a young child has a cardiac condition, you know what to expect, right? So here's kind of the laundry list of what you might expect to see, and some also abbreviations. So patent ductus arteriosus, or PDA, septal defects, both ASD, atrial septal defect, and ventricular septal defect, tetralogy of Fallot, transposition of the great vessels, or TGV, bradycardia, in other words, slow heartbeat, or tachycardia, which is a rapid heartbeat, and anemia of prematurity. So there are a variety of slides that are for your reference. This is the typical structure and function of the heart, and blood is coming in, is being processed and oxygenated and going back out to the body, and then the deoxygenated blood comes back in, gets processed, etc., right? Super complex system. So what do we expect to see with a child who has, and this is an overgeneralization, but for your purposes, what do we expect to see? Well, if the blood is not pumping or getting oxygenated effectively, we're going to see a child who tends to be small. They tend to be potentially weak, to tire easily, to become short of breath. They may have a blue tinge to their skin or their nail beds or their lips. And they're not going to be able to engage in the same level or intensity of physical activity as someone who has a well-functioning heart. So you want to think about that if you see that one of your clients has a cardiac or circulatory issue. Now, that said, each of these conditions have particular symptoms and signs and precautions associated with them. But again, this is not a deep dive into circulatory conditions of infants. So I'm going to give you that, and also to know that in some cases surgery is indicated. If it is a defect that is preventing the child from growing and developing effectively, that may happen really early in their lives. If it's something that can wait, often cardiologists will wait, and sometimes it's because it's safer, sometimes it's because they want the heart to grow a bit and to see what happens. Some defects go unnoticed until later in a child or even an adult's life, and and some just repair themselves. So there's a variety of issues, there's a variety of treatments, and you want to have that basic info about what does this kid potentially look like. So now I have a range of slides, and I'll go through these real quick. They're for reference only. You're not going to get tested on this, but it shows you the differences, in this case, normal heart anatomy and blood flow with PDA. Atrial and ventricular septal defects, right? Tetralogy of Fallot. Transposition of the great vessels. And if you're interested, please, by all means, dig into that some and get your knowledge base up. It's super fascinating, just beyond the scope of what we need to cover. So here's your for class and your thought questions. I kind of answered them, but I want you to go back and think about it. What might you expect to see clinically and functionally with a young child who has a cardiac condition? So mostly functional. So my suggestion is take some of the occupations of early childhood and think about how that child might be impaired. Also, how might a cardiac condition affect the treatment plan? So what are you going to consider, and how might you change up what you're going to do in your intervention efforts for a child that has a cardiac condition? Next up is respiratory conditions or respiratory conditions. The first is asthma. Asthma is very common in childhood, and basically what it amounts to is that the airway narrows and produces a wheeze, and that wheeze happens during the asthmatic attack. And here you can see the pathology of it, and also what on the right there, what an asthmatic airway looks like during an attack. You can see that it shuts down, right? There are a range of triggers, both in the environment and other triggers. And it can, like undue stress, for example, right? But pollution in the environment, allergies, getting a cold, having any other compromise of the airways, having COVID is a potential trigger, etc. So a lot of different triggers. We also know, interestingly, that children who are born in low socioeconomic status and have a range of adverse childhood events tend to have higher incidences of asthma or to develop asthma. So we can have it early childhood. It can also be developed. It can be life-threatening, and the treatment is medication, management of these triggers, and management of the disease, sometimes through diet and exercise, or other methods. The next respiratory condition is cystic fibrosis, which is sometimes called CF, and it is a condition where there is an overgrowth of mucus and throughout the body, right? So it results in a thick cough. The child may have problems with their sinuses, with their lungs. They may have an enlarged heart. There's difficulty digesting food because that mucus is in that system. The pancreas doesn't function well. One sign is fat in bowel movements, and it is a progressive disease. So you can see in the picture on the right that the child is being positioned with their head down so that they can be tapped, and that will loosen the mucus in the airway, and the child can cough it out. As a person with CF ages, they will potentially have more and more complications from the disorder. All right. I'll see you for part 3, which is our last part of Conditions 1. Be right back.